Hello everyone, welcome to my channel. This is Yarmoki Menyel, and today we are going to talk about autism. I will be defining autism and then we talk about the symptoms of autism. As we have been told by experts, autism it's a spectrum disorder, meaning that it's affect people differently. You could be on the same spectrum, but it will affect each child differently. As we know, autism is a developmental disorder. It is not a mental disorder as some people confuse it with, because it only affects the behavior of a person. It is characterized by impaired social functioning and communication difficulty. People will have difficulty in the way they want to express themselves, or they don't even express themselves at all. So it is a developmental disability that affect the way people communicate, behave, and interact with other people. So it's all about it affects how you interact with your environment and the people around your environment. That's what autism is all about. And so I'll tell you the signs and symptoms of autism. Number one sign is that children on this spectrum, they do not interact with other children. They are always withdrawn. They always play on their own. You never find them engaging constructively with other children around them. You'll find them on their own. And sometimes when they're playing with their toys, they will either be banging them on the floor or on the wall, or arrange them in a certain way, and which is not normal. In fact, when sometimes, like with the first time they organize a child with autism, you'll see a therapist will give them the toys, and then from there they will see how they're arranging the toys or how they're interacting with these other children. Number two is that they avoid eye contact. They don't look at you. They don't look at people when you're talking to them. That is number two thing. Number three is that those ones with no language, they will express themselves by shouting, um, or crying. Not even shouting. Yeah, they will be screaming or crying. Those ones who don't have a language, because there are those ones on the spectrum who can also communicate and they express themselves. But majority of them don't actually communicate. So the other thing, they have repetitive movements, like they can move in circles, or they can be jumping in one direction. They can be jumping in the same place, and they keep on repeating that movement. And that's what even one thing that my son keeps on doing most of the time, like when he's bored. They don't have any sense of danger. They don't know what is dangerous to them. They don't know what could harm them. They could be in an environment. You see, like a regular child, when there is a new person in the environment, they will not go to them and interact with them easily. But these children, they will be picked by anybody and they will not even refuse. So that's also another sign that shows that these kids are autistic. Then sometimes they do flapping of hands. They will be doing this as they play. That movement of the hands is not normal at all. And then they have sensory issues. They're very sensitive to sounds. Like mine sometimes, most of the time, like when there's some noise, especially I remember when I used to travel with him a lot, he'll be closing his ears like this. Or maybe when you're talking to him, even right now when I talk to him, he will just be closing his ears like this. That's also another sign of autism. They could also maybe they like to stick to routine. Like sometimes it's hard to introduce new things to them, and if you have to introduce, maybe you have to be very persistent with whatever that you're introducing them to, because it takes them time to get accustomed to. And in fact, sometimes they will reject. You see them, they'll throw tantrums, they'll cry, they'll do a lot of things just to avoid, because they're not used to whatever that you're introducing to them. And then they don't feel pain easily. This type of children. um Even mine sometimes, he could go hurt himself, he wouldn't even cry, or sometimes he would be playing, then he falls down. You see that he has hurt his leg or something. You could even see he's bleeding, but he's not crying. So they don't feel pain at all. And then they have then most of them don't respond to their names. And I think as a mother, that's or a caregiver, that's the first thing that you should notice, because any child by around 6 months, when you call their names, they should be able to respond. But these kids on this spectrum, on this with this condition, they don't respond to their names. You could call them, they will not respond until maybe when you say, but most of the time they don't respond to their names. Then the other thing, they have constant movement. They like to move up and down, and this movement, it could be they could be also like instead of sitting in one place, they, in fact they don't sit still. They're always on the move, and in fact sometimes they can also be very jumpy. You could see them that jumping from one sofa to the other, from one bed to the other. So they most of the time they need like all round supervision. That's the only way you can actually take care of them. And sometimes like when they're playing, they could be kicking the toys, or things things like that. So as a caregiver, those are or as a mother, as a parent, those are the signs that you should look out for. And sometimes I also believe, whatever that your gut tells you, if you feel that something is wrong with your child, the best that you can do is to go to a specialist, go to a doctor or a therapist. They'll be able to diagnose him and then tell you the way forward. Because sometimes as human beings, sometimes our inner being, our conscience inside of us, it's telling us something. Believe it. Go and look for help for your child, because we are told early intervention in this matter is very crucial for you to be able to help your child, for you to be able to see your child function normally. You need to go for this early intervention. You need to go for early diagnosis, because when they are diagnosed early, you'll be able to be given a way forward on how to handle him. So these are the few things I have for you for today. Thank you for joining me. See you in my next video. Bye bye.